Hey there, it's Dr. Rory Cernik with the Hearing Assessment Center. Today, let's touch on the coronavirus, COVID-19, and I want to share some thoughts with you if that's okay. So with the coronavirus, all of us are obviously collectively asked to social distance, and although sticking to these guidelines is crucial to resist transferring of the virus and also to flatten the curve, staying at home with limited interaction can have a huge consequence on our mental health. And in this particular case, I want to refer and reference to loneliness. And did you know that 46% of women above the age of 75 live at home by themselves? So they're already more likely to have some degree of isolation and loneliness, and these guidelines are just compounding that with COVID-19. But we're in this together. I want to share this with you. Hopefully this helps one person, and hopefully you can take this in turn and help your friends and family and loved ones. But chronic loneliness in general, what it does is it increases the cortisol levels within our body, and we know that cortisol is the stress hormone that our body releases under a traumatic event. And so continued or elevated cortisol levels can lead to inflammation, increased blood sugar or glucose levels, fatigue, mental fatigue, etc. And without proper intervention, loneliness increases the likelihood of a host of health consequences and challenge. And so, for example, loneliness is correlated to poor sleep, sleep disturbances, type 2 diabetes. And so that's where your body becomes resistant to insulin, increased likelihood for cardiovascular disease, so much so that loneliness by itself, that variable, increases the likelihood of someone developing cardiovascular disease by 30%. Hypertension, high blood pressure, change in mood and mental status, so the list goes on. So right now, we need to collectively talk about the consequence of social isolation and distancing, which is loneliness. And so following this video, I want to give as many tips as I can on how to improve your physical and cognitive output on a daily basis. Thank you.